of them, guys,
diabetic.
make sure you start pressing their legs so they wake up. Because what you do is a lot, and I love the way you are so passionate with what you do, and that is very important with sickle cell. When you say stress boosting, does it boost your stress or does it lower the level of stress?
Yes.
We need to get something right here because the amount of stress people are in, we don't want more stress. It's all right, keep going. I'm trying to relieve my stress. Keep going, keep going. Be careful how I touch myself these days. Because I might touch myself and I'll pass out. Who knows? If you're hugging me, your hand shouldn't go to my back. Just hug me in front. Don't do that. I don't know how to respond when people say, oh, I'm going through menopause. This thumb you're using to press your phone can be used for so many things. Hello everyone, I'm here with Victorious, but before we go, I'd like to introduce myself. As you all know, I'm Hannah, and if you've not been following us, please do go follow us on our Instagram page, and we have TikTok now, and also our YouTube. Very important because that's where we post all the full episode of all the goodies that we have for you. So my name is Hannah Eza, and I'm here with a very, very interesting personality. I can't wait to hear all that she has in store for us today. Hello, Victoria.
Hi.
Please.
Hi. Thank you. I'm really pleased to be here today. My name is Victoria Ngobo, and I'm a reflexologist and I'm a social scientist in Bakken and Dagenham. I'm working with a group of sickle cell to help them ease their pain and mental health and any complicated issue that they have.
Well done, Victorious. Thank you so much for all you do. Victorious, there's a lot that you do. To be a relaxologist,
a reflexologist, like a reflex and sology, because the name comes from reflex point that we touch and is going through any part of your body. It's the hand or the feet. So we call them reflexology.
Wow, I call it relaxology. Anything that
it
makes
can
you
be
relax,
true because it makes it relax.
So, Victoria, what led you to this? Because what you do is a lot, and I love the way you are so passionate with what you do. So, can you tell me what led you to this?
Reflexology, really, I just came on it because I went through pain, no sickle cell. I went through endometriosis, high level of it. Wanted to take my womb out. So I said, I don't want. And then I went through this pain that led to something else on my spinal. So I stayed almost 1 year bedbound. We're now moving to even going to the toilet. So the pain I went through, we can say today acute, because compared to sickle cell, that is long term. So I've been long term.
But I see compared to sickle cell that
what
you
I
see
can
now.
see, and I said, let me bring them to my reflexology. And I try and I see that it's okay. They feel good. It helps a lot with relaxation, mental health.
And that is very important with sickle cell. The pain, the mental health is okay.
Yes.
Speaking about mental health and pain and stress in sickle cell, and before we dive into your technique, can you explain to me what reflexology is all about? Like, what specific method helps sickle cell warriors?
Reflexology, it can help everyone. But for sickle cell one, because their red cell is like tangle.
As a crescent shape.
Yes.
Yeah.
So it helps blood circulation. When they have it, their blood flow more.
Helps the blood not to tangle and hook together with each other, which causes crisis. When you don't have that, you don't have crisis.
You don't have crisis. Or we can say that maybe take time for the crisis. So it's like pain management. That's the way where reflexology helps in these areas.
My next question is, I don't know how this will sound, but we know so many warriors. I mean, they are used to medication and the treatments. So how does this approach complement that aspect of pain management?
Reflexology is a complementary medicine. They use it, it's already in cancer. Cancer patients use it. They use it in labor. But I have to bring it to sickle cell because it's there, but they are not advertise it as much as possible. So me bringing it in this particular area because I said we have to promote, do more awareness of sickle cell. If we are not bringing what is help to our fellow one. It's not somebody else that will do it.
Definitely, if we cannot help our fellow people, our fellow warriors, who will? I'm asking you, who will? So this is actually for everyone, not just people with sickle cell or people that is affected in one way or the other. Because what people don't really realize is that sickle cell and cancer, they kind of marry at some point, because it's being managed by oncology, because someone was saying to me, although they're under hematology, but people don't really recognize it. When they hear about hematology, what comes to their mind is cancer.
The cancer.
And don't know that what sickle cell people go through, pain that cancer people go through, is not as much as what sickle cell people go through.
No.
Going on to the next question. So this is about quick relaxation techniques for sickle cell massages. So many listeners face sudden pain. Sometimes when the pain flares up, it's sudden. So what's a simple technique they can use in this moment when the pain suddenly flares up?
Because the pain is unpredictable and they don't know when it will come. So I will explain in two ways. When they're alone and when they are with someone. So when they're alone, on the hand, because when they're alone, it's only the hand that they maybe have 60.
That's the only accessible point they have.
Points that they have. In these pictures, you can see we used to say, do like a cross, and in the middle is a pituitary.
Okay.
The feeling relaxed one as much as possible. But don't worry, all this part is the head. Anywhere that you will massage, like he showed here, it will give you relaxation. And the relaxation point really, they are on this side of the hand.
I hope you don't make me sleep right now. The way you're saying relaxation, I feel like I'm going to sleep.
On this, so here is headache, migraine, sleepless is here.
Okay.
Because each part of this thumb is one somewhere in your head, and the top is the brain.
Oh, this is quite important, because I interviewed someone, like lots of sickle cell patients, and they said sleeplessness is one of the things they battle with. It's difficult for them to sleep sometimes.
Because of the pain. The pain interfere everywhere and they cannot sleep.
So can you walk us through a quick exercise?
Let's talk about sleeping.
Okay.
I prepare something for you.
Okay.
Which is this one. It's made by Association of Reflexology on your hand. Like you see this rose one. We came to that. The brain reflex that help calm the mind. Because when we are going through the pain, we have to switch our mind somewhere else. So by massaging this part, it release some hormones.
The endorphin
Hormones make you relax. A natural painkiller. That's why reflexology is natural medicine. Then you come in the middle here, which is a solar plaster, giving you more energy. Solar plaster.
For breathing exercise.
Yes.
Oh.
You can do 4, 7, 10 or 4, 7, 12. 4 seconds to breathe in. Take it 4 seconds. Don't do more. You hold it 7 seconds. And you bring it out slowly to 12 seconds.
I feel like we should stop. I don't want to sleep right now.
7, 12 or 10.
That's amazing. I actually felt relaxed, and it was less than 1 minute. That's amazing. That's amazing. Okay.
And if you have, I say, or if you're alone now, if you have somebody home that can access to your feet, it's more effective. Or if you cover yourself, that's another process, which is calling the hard process. Walking through something on top, just to stroke it, giving you relaxation. But that's another process. They call it the hard process.
Oh, it's like something very fluffy.
Yes.
Just stroking something fluffy, like your duvet. That is very fluffy.
Because when we go in the hospital, the way the patient position is the way that you have to give relaxation. We're now disturbing someone.
Okay, as if you know where I was going to. I was actually going to massage and self-taught. Massage sounds like it sounds luxurious, if I must say. How can a warrior use this at home?
That we have to learn more about technique to help our child, our sister, whoever we know that are going through pain and crisis regularly. if you know the technique, if you learn where to touch, if reflexology can help women in labor to not go through epidural, I think that it can help sickle cell also even more better, because I run some pilot that participant told me that delayed my crisis. I had the crisis, but it was not that severe. My period pain calm. My headache, I was referred to neuro, but now I don't need neuro. So I think that is something that help a lot.
Okay.
Consider it, try it, and see.
So that's very good. I'm going to try it. No more medication for sleeping. I'm going to
Yes.
going to breathe in, hold it, and breathe out. 4, 7, 12.
Yes.
I'll
Or 10
remember
if you
that.
cannot, because some people they cannot.
In case you can't, just do the one you can so you don't pass out. So what areas should they avoid? Like what area of the body when you're trying to relax? The reflexology area, any points that they need to avoid?
I think that especially when you are pregnant.
Sorry, I have to ask this because it's in my head. Why pregnancy? Is it because the baby doesn't sleep? Because when the baby is sleeping, it's helping the mom.
Because it's another technique or way for pregnancy women. So you can see reflexology have some little punches. The way you massage a pregnancy woman is not the way I massage you. Because some area, uterus, ovary, is not the same. Fallopian tube, you touch there, then baby can come out. So if you are not pregnant and then you want to do your normal relaxation technique, you can do the sleep one. I have headache. Can I show the headache one?
Yeah. So you're gonna show us
The headache and the migraine. Hand self reflexology. So if you are there that you want to take pictures, you can see, you can do. We come back again. The main one is on the head. Here is the diaphragm, which is when you have headache, you can't breathe properly. So you need to release your diaphragm so that the air can get in
you need
easily.
to relax your diaphragm.
Yeah.
Okay?
If you come to see me, I will work on your feet. But if you don't want me to touch your feet or you are sensible, I work on your hands. And the same thing is there. That's where I work. I work more now in other organs in your hands. So those who want,
when you say stress boosting, does it boost your stress or does it lower the level of stress?
Yes.
We need to get something right here because the amount of stress people are in, we don't want more stress.
No.
Okay.
So these 2 points there, which is this one, from year to year, is 7 bone, which is the cervical, like your cervical back there. So from year to year, 7. From year to year, that's 12, which is the thoracic.
Okay.
And then the lumbar, which is 5 bone. So it's a science. And you need technique. So we have a lot of technique in that. Let's see. If I'm massaging someone, I will hold the hand to support and I will do like this. So that's one technique to show, like thumb moving. We have another technique which is moving circle. So it depends which technique. We have a lot of technique. We also have this one.
It's all right. Keep going. I'm trying to relieve my stress. Keep going. Keep going.
Come back with solar plaster, which is again boost of energy. Always. The story say that someone passed away and press on the feet for many hours and the person come back. That's what they told us.
Why didn't you tell me this?
That's what they told us when we are studying. So that's something else.
If your loved one dies, make sure you start pressing their leg so they wake up. Wait, did you know this?
Do you know why are we using the spinal? Because everything is our spinal.
I'll be careful how I touch myself these days. It's like everything is connected. I might touch myself and I'll pass out. Who knows?
No, you will release yourself. You will help yourself. And you will feel better because everything is on our spinal. Did you ever have lumbar puncture that they go to your back and take fluids?
Oh, when they're collecting liquid from your spine.
Yes.
Oh.
So why they cannot take it here? Why they cannot take it everywhere? Why are they going on the spine?
That's a good question. Why can't they just take it anywhere? Why spine?
Why spine? Because our life is there. Everything is there.
No one is touching my back anymore. Do not touch my... I don't care. If you're hugging me, your hand shouldn't go to my back. Just hug me in front. Don't do that.
Look, on your feet, you can see that it's also related. Can you see each bone here is related to one of your organs? So that's why they're going to find if maybe they have done some, you still well, or they need more investigation. They just go through lumbar puncture. and then we find everything because everything is related. So they go through 4, 5
Wow. I'm gathering my
bring
spine.
to bring
No,
the fluid.
I have to
So
actually make
that's
something that will
that's
protect my spine.
oh, this one is simple for allergy.
Oh yeah.
Those
That would
who
be very
have
interesting.
allergies, summer allergies, so just go through the top and through the. So this little punch here explain to you exactly what is mean and how you can see.
Hmm.
And that's my favorite one. Menopause.
Okay.
Menopause is my favorite because I'm
We'll
going
all
through
get
menopause.
there. Oh, what? I don't know how to respond to that. Okay.
Again?
Do I say congratulations?
No.
I don't know how to respond when people say, "Oh, I'm going through menopause."
Until when you are there, and then you can understand, oh, I hear my mom say that. Oh, but as another study going on, aging well. Did you hear about that?
No. Okay.
Menopause, we come back again to the head. The head is controlling a lot. When we go through pain,
This thumb you're using to press your phone can be used for so many things. So guard it properly.
so I think that this is the right hand. Yes, this is the right, which is the liver. So left, no, this is the left hand, isn't it? Because the left is the liver, the right is the spleen. On this side, on this side. So you do the same massage. That's for menopause.
Okay. When I get there, I hope I remember. This is a lot to take in. Just for reflexology.
Yep.
Wow. We've covered a lot. Is there any important thing you can tell us, like an advice or what to do that we've not mentioned?
Can advise that pain is what patients say that it is. Your pain and the degree of your pain is not what are we saying. Until when I went through pain, I realized that to manage pain, you have to have a lot of tools that help you to switch, like distraction or something to hold on. For my pain, I took it like an enemy. I took it like someone that you can't stop me doing what I want to do today. And no matter what, I mean, I'm in pain or I'm already in pain. So I will go and do what make me happy. When I started to come out, I couldn't work. I was like bending. But if I want to go to hot room, because I like hot room, which helped, the pain was there. The pain was my manager. The pain was telling me, today you are not waking up. Today you can't put one. So for my advice is hold on to something that help you. This 5-minute distraction, it will be a lot.
So accept that pain and find something that would distract you. Acknowledge the pain. Find something that would distract you. How do you get distracted from pain? So let me explain sickle cell pain. So many people explain it in different words
Yeah, that's
and
what I'm
different
saying.
ways.
That
Just like
it's
you
what
said.
patients say that it is, because my pain is not the same like your pain.
Exactly. So someone said this. If you've watched a werewolf movie, you know when the werewolf is when you're changing into to become a werewolf. You know that breaking of the bone, your body breaking, all your bones breaking. So that's the amount of pain you feel.
I hear being stabbed. It's like a stabbing.
Yeah, someone
stabbing,
has said
stabbing.
it's like someone is constantly stabbing you and stabbing you. And someone has said someone is using a jigsaw to keep crushing. And someone else have said that it's like using hammer to break a particular bone over and over and over again for
Breathing
days.
as well. Breathing. Even though it's just, we're now doing the 4, the 7, but breathing.
So I'm thinking, how do you remember to even breathe when you're feeling that kind of it? Do you understand? It's like you're saying, okay, I don't know what it is. It's like saying you're in labor and someone is trying to remind you to call someone for your child that is in after school. At what point will you stop the labor pain and to remember to call?
Yes, it's not easy.
Wow.
Especially with sickle cell that is unpredictable. It can happen everywhere.
It flares up.
But we have to hold on to something. We have to say, you are here, acknowledge that you are here. Singing helped me a lot. I was singing on the, can you imagine? I can say maybe sickle cell can have time that no crisis, they can go out, but stay 1 year, bedbound, your children going to school, find you again, sleeping there, going, so you, no control. The only thing that, and in this country, I don't have family. So I'm coming from France. I don't have family here.
Yeah,
it's only
that's
me
another thing.
and my
Je peux français.
me and my children.
She's French.
So to see my family, they have to come or on the phone. Or honestly, my song was, "My tomorrow must be greater than today." So my today was lying, but my tomorrow, I was saying that it has to be great.
That's what happens when you have hope. You have hope.
Hope. You have to hold on to something. And this one, baby, don't worry
Hey,
about the things. Everything is gonna be alright. So you have to bring it. I know that you will say, "Oh, when is tomorrow? When is everything gonna be alright?" But you make it be alright. When you're alright, some people were saying, if you say, "Victoria, you will not see that I'm having disability," because when it comes to dance, I'm dancing. The pain, no pain. When the pain say, okay.
And that's the thing. That's the thing with pain. That's the thing dealing with life-threatening issues. Some people say, "Oh, you have to take it easy. You have to take it easy." It's not about taking it easy. It's about having hope.
Yes.
Holding on to something, not forgetting who you are, still seeing yourself like you're able to do stuff. And that actually helps so many sickle cell patients looking forward to something. When they come out of the hospital, they're going here, they're doing this, they're going home, they're doing that. So they fight to make sure that they do that thing they want to do. They do that thing with family. Imagine my son's birthday is coming up and you want me to stay in the hospital. This sickness, this pain, you have to go. I have to celebrate my son's birthday with my son. It's that thing that makes you survive. That going out, that singing, that's going out with family, spending time with your loved ones.
That safe place that when you go, you feel good. This relaxation mode that come to you. I'm not saying that perfect. I'm not saying that try even 5 minutes. You will come back. Just try everything that you can, and then you will find something that is manageable for your own case.
Thank you so much, Victoria. In case you don't know what we're talking about, this will be put on the screen so you can read more about it. If you want more information, please send us a DM or you can email us. We'll put our email address below. And if you want to contact Victoria's, her contact is also here. And we actually have free section for massage. Please, can you tell us more about that?
Because I know that my people don't have enough. That's my own way to support.
That's your way of giving back.
I'm looking for funding, but at the moment, I don't have. So I'm bringing it, a little group. Maybe with you now, it will be big. Who knows?
That's another way to give back. If you want to work with Victoria's, you're welcome. You work with us. Then we can
be big.
Help more people find the benefit of this method of managing pain.
Why not train others to help, like a mentor?
Yeah, you see, that's good.
Why not train?
Because we have a large community out there. And the thing I found out with this awareness, creating awareness for sickle cell, I found out that every Black and Asian person knows someone with sickle cell or thalassemia. So even if it's not in your family, if it's not your child,
your colleague, your neighbor,
your colleague, you understand, your friend. So why don't give back? You don't have to wait for it to come to your home. Just learn how to give back. I'm so happy for what you do, and I pray that we'll continue to work together to make sure we create more awareness and help people in pain and help them manage. That's all we can do, isn't it?
Thank you to respond really, because I was asking where to find them. Yes, I know where to find them, but with you, I think that I will help a lot of mothers or female. Oh, excuse me, this place, because it was given with domestic violence, men are restricted. But I'm still looking for where to help men as well.
So this is for women only.
Yes,
But
that's where
fingers
I got the
crossed,
place.
touch wood, fingers crossed, we'll be able to get something for men.
For men.
Please.
Where I can see everyone we now know in saying that this is a female, this is a man. So if someone have where I can see all of you.
This is female only. I'm so sorry, but that it is what it is.
Yeah, but that's where the location, I mean, it was given by domestic violence area, which is Mom on the Mission. So
thank you so much, Victoria. I can't
Thank
thank you
you.
enough. Thank you for coming on this journey with us. Our viewers, please follow us, send
Yes.
us DM, ask your questions. Please do answer. And I appreciate those of you that have asked questions, that have followed us, that have appreciated what we're doing, because it is your response that is making us actually go on to know that we are touching people. That I get so many responses. Oh, I never knew this. I never knew that. I never knew this. And that is what we are for, to explain this thing, to bring awareness, to bring to light this sickle cell disease. And not just sickle cell, thalassemia. So many diseases that affect the BAME community. Is a lot. We've not even started. We just stuck on sickle cell for now. Although today we are celebrating, this month is sickle cell awareness month. So relax. There are so many things that we're bringing to you. So please follow us. We have a lot of goodies. See you and bye for now.
If you want to take any picture